Palliative care is specialized medical care for people who have any kind of chronic health problems. So that might be somebody with heart failure or lung disease or kidney disease, cancer. Those patients experience a lot of symptoms related to their disease process and to their treatments. And so palliative care provides an additional layer of support for those patients who need symptom support, such as pain and other distressing symptoms that they might be experiencing with their chronic illness. I think the best thing that palliative care does for the patients is allows them a little bit more control. Chronic illness takes away a person's control. They're having to go to the doctors, they're having to take medicines, people are telling them all these things to do. Palliative care, we meet the patient where they're at. We talk to them and offer them control on the things that they can control. We really focus on their quality of life, what's important to them, and try to match their goals up, or their treatment with their goals that they have. Sometimes they may not be the goals that we have in mind, but we really focus on what's important to the patient, what their quality of life is all about, and what their goals are, and try to match up that treatment to their goals. We don't replace their doctors or other providers. We're kind of an extra layer of support for those patients. Patients can still seek aggressive treatment and curative treatment for their chronic illness while they're still on palliative care services. We kind of walk side by side with the patient during that chronic illness journey. Chronic illness can be, for many years, patients experience chronic illness and have to deal with a lot of the side effects and social and emotional and spiritual issues that impact them from their chronic illness. So we're able to provide that support through our team approach. Our team is made up of doctors and nurses, social workers, chaplain, dietitian, therapies, all to help with the patient's quality of life. Their physical symptoms, which might be pain or nausea or vomiting, their emotional well-being, their anxiety and depression, how the disease impacts their livelihood and how it impacts their relationships with their families. Also spiritual support for those who need that spiritual component. Our social workers also work a lot with connecting them to community resources to provide them with that additional support they need in order to manage their care during their chronic illness. If you're a patient or a family member who has a chronic health issue and the patient is experiencing symptoms that are interfering with their quality of life, please contact your physician and let them know about those symptoms and ask for a palliative care referral. Patients don't have to suffer in silence. There are a lot of treatment options and a lot of support for the symptoms that you're experiencing. So please let your physicians know that you're experiencing these symptoms and ask for the palliative care referral.